2 years ago today, the world had its first reported COVID-19 case. Since then, the virus has killed more than 5 million people globally and infected nearly 255 million. The pandemic has really taken a toll on all of our lives, especially testing our mental health. For our youth, it's been tough since the nasty virus took over.
Hospitals are raising the alarm after new numbers show an uptick of children being admitted for mental health emergencies. CBS 4's Karli Barnett joins us live from Nicklaus Children's Hospital in West Miami-Dade.
And Karli, it's hard for children to realize normalcy in the face of this pandemic, isn't it?
Oh, Elliot, Lauren, extremely difficult. It's difficult for us as adults. We can only imagine how children are absorbing the situation. And that is why here at Nicklaus Children's Hospital, they say they have seen the most visits ever to emergency departments in children for mental health related reasons. And that's why they want to sound the alarm tonight and give a warning to parents so that they know there's help available. The pandemic brought changes to jobs, schooling, and day-to-day life. And many children have been impacted as they navigate change and how to cope with it.
Before the pandemic, we were noticing an increase in mental health issues, but some people are referring to it now as a parallel pandemic of mental wellness.
Psychiatric social worker Gina R. says a number of factors play a role, like more social isolation, increased social media consumption, and stress at home.
Our highest ever year, we are already 400 patients over that highest year, with November and December not even calculated to date.
And those numbers do reflect what national data is showing about children going to the emergency room for mental health reasons.
National average for 5 to 11 years old in 2020 increased 24%, and the numbers of ED psych visits for 12 to 17 increased 31. There's estimates of an up to 50% increase for the year 2021 across the board.
Clinical psychologist Dr. Ana Maria Ojeda says they see children and teens with anxiety or depression expressing symptoms like shortness of breath, stomach pain, heart palpitations, also thoughts of self-harm.
Most of them are coming due to suicidal ideations, suicidal attempts, and we have seen an increase since the pandemic. Like Gina said, there's been a parallel mental health pandemic. We're also seeing that there's an aftermath where kids are now realizing what's happened. It's almost like a shock.
They say some ways to combat the problem are fostering open and judgment-free communication, setting healthy social media boundaries, and knowing it's okay to ask for help.
It's a process. You didn't get here in one jump.
Well, as you can imagine, there's a lot that is involved with this. And coming up tonight at 11, we're going to get more into those factors of what is leading children to this point. Also tonight, we're going to explain some steps, some bullet points that parents can use to help foster what they call mental wellness at home before it gets to the point of a mental health crisis. But for now, live at Nicklaus Children's Hospital, Karli Barnett, CBS 4 News.